Good afternoon. Thank you for joining us for referral updates coming to Central Coast Local Health District eReferral system. My name is Phoebe James and I'm a Professional Development Officer with the Hunter New England and Central Coast Primary Health Network. Before we begin, I would like to acknowledge the traditional custodians of the lands we are meeting on. I am coming to you from a Awabakal land and it's very sunny and cold here today, and pay my respects to elders past, present, and any First Nations people joining us. I just wanted to mention before we start, this session is being recorded. The recording and the PDF slides will be available in the Education Library on the PHN website in the coming days. If you have any questions, please put them in the question box and we'll get to them if there's time. It is now my pleasure to introduce Dr. Ellie Warren, Medical Director for the Central Coast Local Health District, GP Staff Specialist and a GP at your Family Doctors Erina. Siddharth Ramani, Engage Outpatients Project Manager for eHealth New South Wales. And Risale Bentarosso, Clinical Business Analyst for Central Coast Local Health District. I will now hand over to Dr. Ellie Warren. Thanks, Ellie.
Thanks a lot, Phoebe. If you can just move to the next slide, guys, thank you. Yes, thanks for the great introduction there, Phoebe. I'm a GP working both in Gosford and Wyong hospitals and in private practice, and it's been nice to see this new system set up from both inside the hospital and from GP land. So it's been a long time coming, and it's been exciting to see it put into action and be able to use it finally for these 4 outpatient clinics that we'll talk about today. So I guess the main benefits of this e-referral process are very practical. So we get that real-time sending from the GP into the outpatient clinic, and that is at the moment, so Sid will go through this in more detail, I think, but we're referring to antenatal, peds, gynae clinic, and there's a neurology pathway as well, but that's not currently available to GPs. So they're really highly utilised outpatient services to test this new model. So we love being able to refer easily using our medical practice software. So this is fully integrated into our medical director platform and best practice platform, making it super easy for GPs to do then and there. So we click on the health link form that we are very used to using for the Transport New South Wales driving medical assessments and for my aged care referrals. So we'll do a bit of a demo later to show you how easy it is. So that integration has just made it super simple to send the referrals off through cyberspace directly to the clinic, where it's triaged by the outpatient clinic staff, and then we get a very swift response back from the clinic, which is new, and what helps GPs and referring clinicians sleep well at night, because we know that that referral has been received, and there's a closing of the loop, I guess. So something that's bothered us previously is that we think the referral is important. The patient might pop it in their drawer for a few weeks or forget to follow up and forget to call, but we know that that's all locked in now, and the outpatient clinic follows up and makes the appointment that way. So the copies of the referrals that we create are saved into the correspondence section in our medical software, and as well as and that really sort of great logistical benefits. We're eliminating the referrals getting lost, sitting on fax machines that aren't checked anymore, or even some referrals are still sent by post or manually through the patient. Some of that is expensive to practices, and we get super fast communication to and fro from these clinics. And there's a lovely benefit too, where the clinic can ask for extra information, and then we can update the referral and send it back electronically as well. And so it's overall faster and we get really lovely triage process where the referral criteria are built into these new electronic referral forms. So we can't get away with saying, please do the necessary, or thanks for seeing so-and-so for a review. We really have to be more detailed to help the triage nurse and the clinicians we're referring to help expedite those referrals if they're urgent, and pop them on the non-urgent list if they're not so urgent. So I hope I've sort of given a good overview there. We go on to the next slide. Little bit of a delay here, sorry folks. So this is just a screenshot of our HealthLink page that jumps in from Medical Director or Best Practice Software. It links up with 10 of the main used best softwares in general practice. So very likely that your system will be supported if you're not using one of the two main BP, Premier or Medical Director. But alongside there, the Roads and Maritime Services star boxes and My Age Health Care Referral, we can see New South Wales Health Outpatient Referral, Central Coast LHD. And actually I've used a couple of the other boxes there referring to Southeastern Sydney LHD for fertility referrals and things. So that's an added benefit. You can actually refer out of area to highly specialised services that have been previously difficult to navigate. So that's fine to click on through there. That's just a more detailed slide next, where we go onto the template to select the doctor we'd like to refer to. So we've, say, clicked on an antenatal referral, and then we can either choose specialist unnamed referral if we're not fussed about the doctor we're referring to, or we can choose our favourite specialist from a drop-down box there. And you can see it helps us prioritise the referral there. And uploads the results, and also autofills all of the patient information and past history from the medical record. So fantastic utilisation. When that referral is sent through, you can see this is our results inbox here. We get a notification back from the clinic to say that the referral's been accepted. But if it hasn't yet and we require more information, then we can see what else they need. Sometimes they need an ultrasound or some other investigations, or a little bit more information before they'll accept and triage the referral. So thanks there. For the next slide. And there are some fantastic resources that we've got access to. The New South Wales statewide Engaged Outpatients website talks us through how to do a lot of this stuff. But Health Pathways team, Hunter New England, Central Coast, Erica's team has been working hard to make sure our health pathways are updated on our antenatal referral page, the PEDS referral page, and gynae referral pages, so that you can click on the links there, and they'll take you through to these eReferral instructions on exactly how to do it. So you can see the practice softwares that are supported there. So there's not many that that wouldn't be used in a usual general practice. Thanks there, Sid. Hope that was a reasonable intro.
Thanks, Ellie. I'm just going to wait for the next slide to pop up. We're just a little bit of delay. So just a reminder to our practices, we've had 3 months of hybrid workflow processes where antenatal, gynae, pediatrics and the neurology clinic within the specialist centre have accepted all referral modalities. However, as of the 9th of July, these clinics have moved on to accept electronic referrals as their only method of receiving referrals. So they're no longer accepting fax or email referrals. The referrals received in this modality will be automatically rejected, and an email will be generated and sent to the practice asking for the referral to be resubmitted as an electronic referral with the appropriate support details if required. So our clinic users, our LHD users, will continue to record the referral and referrer details on spreadsheets when non-electronic referrals are sent through, which will then be shared to our lovely PHN contacts to assist with the adoption of electronic referrals. It would be again, your best interest to adopt eReferrals as soon as possible, as this initiative is looking to expand to many other services within the district as well. So familiarizing yourself with the forms and functionality now with the available support would be very beneficial. Did my screen disappear?
Yes, it did. Sorry. Sid asked me to share for him to share his screen.
Yeah,
Sid,
sorry.
you're on.
Can you hear me?
Yes.
Yeah.
I'll bring up the slide. Apologies. I thought it might just do it in the background, but I didn't know it'll take away the screen. Yeah. So you're on the
Slide 12, please, Sid.
slide 12. Yeah. And I'll make it. Yeah.
Thank you. So we'd like to share with the group the referral results we've received over the last 3 months, where we accepted all referral modalities. And as you can see, nearly 60% of all incoming referrals have been electronic referrals, which is an amazing, amazing result. It shows that this is the preferred method of referral modalities for our GPs, and we hope to now see fax and email numbers completely diminish going forward. And Sid, if you wouldn't mind just clicking through the next part.
Yep.
There's going to be this table that shows the distribution and breakdown of the referral numbers received. Thank you. And next slide, please. So similarly, the graph on the left further breaks down the data where we can see the trends of each referral modality over the hybrid period. There's been an excellent uptake in electronic referrals with a small dip in June due to a public holiday. And there's a steady decrease in emailed referrals, which is excellent once again, and an initial increase with fax referrals with an expected decrease moving forward. On to the right there is we are also tracking the number of GP sites that have adopted the eReferral modality. We are very grateful for their support and willingness to change as reflected in the increasing onboarding of our GPs. And the next slide would be, I'll hand over to Sid. Thank you, Sid.
Thank you, Russell, and thank you, Dr. Ellie. Yeah, so we're very excited to showcase the new feature that we're releasing onto the platform. As Dr. Ellie mentioned in the benefits, so you'll now be able to respond to requests, correspondence requests that are made from the clinics, and you'll be able to submit information that they've requested for, answer any questions that they've asked about. So that's by request from the LHD, and you'll also be able to, if the patient comes in and there's a change in the patient's circumstance, you could request a review of the referral priority. You could request additional. You could provide any additional information that might have come up as a change in the patient's circumstance, or you could request a cancellation because the patient's feeling better or no longer needs the referral because they may have gone elsewhere for the care. So you're able to do that two-way communication. Really opens up the doors for two-way communication. So not only just sending attachments, but also be able to respond via text to any request made by the LHD. I'll jump into a demonstration to show you how that would actually work. I've got the Medical Director Practice Management software open. I'm actually in patient Bellamy EO test is our test patient. And what I'm going to show you is how to make a referral, just as a refresher. And then following that, we'll have a look at how to send an update as well. So I'll go to Make a Referral tab. And as you saw, I clicked on the New South Wales Health Outpatient Central Coast. An important point to note, there's been a distinction made between antenatal and early pregnancy assessment services here to ensure that the referrals go to the right clinic. For the purpose of the demonstration, I'll just pick the antenatal clinic. It comes up with Central Coast as the facility, so we'll launch that. And here, as it loads, we'll see all the tabs. I'll just walk you through quickly what these different tabs are. Requested information is where you do most of your interaction. Most of the referral criteria, referral information, referral priority, all of that sits in the requested information tab. Then you have the attachments that are pre-populated from the practice management software, medications, allergies, and alerts also pre-populated, medical, social, family history, in similar vein, and also then patient information also pulled from the practice management software, and your referrer information that's also pulled from the practice management software. Important to keep your practice management software up to date and ensure practice name, etc., are pulling through correctly, because we have in some cases practices may be labelled as main surgery, which causes confusion from us, both from a reporting perspective and also when we're triaging. It helps us triage better. Triage better when we've got the right practice name that's coming through from the practice management software. So that's a quick overview of all the tabs. Now I'll give you an overview of this tab here, and then we'll go through and make a referral. Referred to, this is pulled from the National Health Services Directory, associated clinicians for that particular clinic. So as Dr. Ellie mentioned, you could pick a clinician that or is relevant for making this particular referral, or you could leave it unnamed, as is the option there. So if you're choosing, if a patient wants to be seen as a private patient, it's always better to have a named referral, so that they can be seen quickly. And then you've got the referral date defaulted to today, referral type, new and continuation. You can see here the red bold text, which is sort of new as an update referral feature. So we're calling out that if you want to send an update, please use the referral update feature. Referral validity is 12 months, 3 months, or indefinite. Referral priority, as Dr. Ellie alluded to, is defaulted to urgent for antenatal, but you've got non-urgent, semi-urgent. It's an opportunity to communicate your thought process on the urgency of that particular referral, and then you could provide additional information down here as to why you think it's urgent. The clinic might still make a different assessment based on the information that you provided and based on the referral criteria they have of the referral urgency. And that gets updated both from a patient and a GP perspective, which we'll also go through in a little bit more detail. Patient available for appointment at short notice, yes, no, and then patient suitable for virtual care. If you're unsure, you can always leave it as unsure. And then the Health Pathways link, we always encourage you to launch the Health Pathways, have a look, because there might be some additional criteria on top of this that the patient, that the clinic might require. On top of what you already see on the forms. And if you need to get the clinic contact details, you can always use the Health Pathways pages there, and they've been updated as Dr. Ali alluded to earlier on in the presentation. So you can select the particular reason as to why you're referring in the patient, and then it brings up the supportive information. So this is if appropriate. So we don't want to stop any referrals. So for whatever reason that this information is either not appropriate or not available just yet, you could say no, you haven't included all the supportive information, and provide the reason as to why. So for this purpose, I'll just call it out as test. You have then the referral details. text box where you can provide the reason as to why you're referring the patient in. You can attach your consultation notes from the practice management software. In this case, we'll just do this, and then you'll be able to also edit the notes once you've added that there. So you can make an update like this. There is a character limit of 4,000 characters, so you can use the next box, which also has another 4,000 characters that you can use to provide further information. Any additional information that may be useful for triage purposes is also shown in this information icon here, and you can see what that is and make necessary attachments as appropriate. And this is just another text box for you to provide that further context should the first not be sufficient. Preferred model of care, we'll just select GP led because it's an antenatal referral. We'll fill out all the mandatory fields there and progress this referral through. All these are mandatory. So expected delivery date, you can either provide a delivery date if it's known for the patient. If it's unknown, you've always got the option to select that as EDD undeterminable. And then a further feature, so if there are any prior pregnancy complications, you can select yes, and it asks you to select what exactly. If there are none, then you can collapse that by saying no. Also, conditions, risks, and barriers to access for the patient. So if there are carers and guardian, it'll ask you to populate that information. Similarly, if there is interpreter required, which language for, and then any other needs, where you get another additional text box to provide that context. Any other considerations and barriers, also another text box to provide that context. So plenty of opportunity to provide a lot of context with regards to the referral. Then we come to the patient consent. So this is the consent to send a referral through electronically between HealthLink and the LHD systems, and also receive communication by SMS, phone, email, or even letter, as selected by the patient's preferred method of contact. So that brings this section to a completion. So all these red asterisks here are mandatory fields. So if you've not completed it, it'll prevent you from submitting the form. If you've completed everything, it'll progress through the submission. So you have the opportunity to preview, submit, and also park your referral just in case. You're not sure, you don't have the full information. But here is what it looks like when you hit submit, both from your perspective and also this is what in the receiving end the clinic sees. You can see the entire referral, any attachments and any updates from the other tabs that you made, all summarized in the one place. So you can see here referral ID CCLH 1067. Now this starts to become important as we go to make a referral update. So I'll just close this window here, launch a new form, and then we'll go to referral update. It might just take a minute to load because it's a test system. It's a bit slow to load. And once it loads, I'll take you through the update referral feature. So prior to that, we were in the Make a Referral tab. Now you can come to the Update Referrals tab, and it shows you already the patient information, the open referrals for the patient in this period here. It defaults to 6 months, but if you want to narrow or change this date criteria, you could do that and then hit search, and it will bring up the relevant results. Now, Tasmania Health, it only shows because it's for the test system. You won't be able to see Tasmania Health unless you're a GP also in Tasmania. Then we come to the list of open referrals. CCLH 1067 was the most recent one that we submitted. So here I can go and see the original referral. And I can see the referral history. So in this case, all we see here is that the referral has been received by the facility. So this is that notification readily that's available to you, so you can see where the referral's at. So I'll show you an example of one that I've worked on earlier. So there was received, and then we responded to a information request earlier. So if I go to referral history, I'll be able to see that in the PDF there. And then how to make an update. So we'll just go ahead and make an update for this particular referral here. So we'll click on this provide additional information icon there, and it launches into the referral updates tab. Just a simple referral update screen here, so you can select why you're providing the additional information. Are you responding to an information request from the LHD? You're requesting a referral cancellation or requesting a review of priority, and then you can make the necessary attachments there again. So you could say you could attach it from your practice management software and provide additional context as requested. And here you could also be responding to any questions asked. So for example, let's say, pardon me, in this case, they've requested for that additional information and you don't yet have it. So you can say that reports have been ordered, awaiting it. So there's that two-way interaction rather than people having to make phone calls and referral getting put on hold. This is near real time. And you'll be able to see as and when it's submitted. So we'll go ahead and submit this with an attachment. So I'll make one of these attachments here, as it's a test system. You get a lot of attachments. In reality, it may be a little bit different. So we've made that submission there. It might just take a minute or two before it updates that referral there. You can see here in the Health Link tab, you've got a history of all the referrals made. So you can see -02, meaning we've submitted an addendum. So 1067 was the first referral that we submitted. -02 is the addendum that we've submitted. So you can, the update referral that we've submitted, apologies. You can go back in and see if the update's been received once it loads. So 1067, we'll go back and have a look there. You can see that we requested that review of priority and sent through that update. So you can see in some cases you'll be able to see a whole array of history there. I'll show you an example that I was looking at earlier. Bear with me. So you can see what state that particular referral is in, referral screen, triage, post-triage admin, review of priority. All the history can be seen here, which could be quite advantageous to see where the referral's at. The key point to note here that you won't be able to send a update to a referral that has been processed completely, or a referral that's been cancelled or closed out. So you won't be able to send an update in that case. That option will simply just say you won't be able to do that. But if the referral's in any other state, you'll be able to send the referral update there. So that brings the referral update part of the demonstration to a close. I'll just quickly show you where you can see the correspondence. So we're in Medical Director. We'll go to our correspondence, and I'll just refresh to see if there's any loaded. As you can see, the latest referral receipt has also come through. So if the referral's put on hold, you can see here why the referral's been put on hold. They can provide that reason. So you can see the comments need lab results. So you could use, again, the update referral feature to respond to this request. So you could go back to the health link tab. I'll minimize this, and then you could start the update referral feature like we demonstrated earlier. So that really opens up that two-way communication between yourself and the clinic. So yeah, that brings us to a close for the demonstration. I'll just quickly jump back to the slide pack to talk you through um, the different types of notifications at different stages. So you get a notification, and the patient gets a notification on referral receipt. On hold, as you saw in the GP software, you get a notification there. Any messages, ad hoc communication, the GP gets or the referrer gets the notification there. Screening outcome accepted, not accepted. Not accepted is the one that goes both to the GP and the patient. Accepted just progresses to the next step. Any redirections made by the referral, pardon me, by the clinic, because they might say the care required for this patient might be better provided in a other facility. They might do that redirection themselves. Both yourself and the patient will get notification of that. Reassigned referral, because it's an internal reassignment from one clinic to another internally, so no notifications there. Triage outcome accepted, not accepted, both to yourself and the patient. And then cancelled outcome also for whatever reason, withdrawn by the patient, withdrawn by yourself, unable to contact the patient, referred did not respond. Any of those reasons goes by to yourself and the patient. You can see that none of these notifications happen when you send through fax referrals. So as it was called out earlier, very important to switch now to the electronic referrals for all these benefits. I'll hand you back to Rasail to talk through these slides here.
Thank you, Sid. So this slide is just highlights some of the key feedbacks from our key end users, which is focused on 4 important areas, and Sid may have touched it some of it during his demonstration. So one of the main things that he's mentioned was the main surgery within that practice names and identifiers. So many practices have multiple branches and often use main surgery without any unique practice names, leading to some data inaccuracies in the clinic end. So if you know your practice has multiple branches, please check the document on our HealthLink resources for information on how to check and correct your practice names. The second one is patient identifiers in our attachment. So we've noticed a lack of patient identifiers in the header and footer of attached investigations, which poses a significant clinical risk for patients. The best way to actually rectify this is by ticking one box in your practice management software setting to include the patient identifiers in the header, footer, or footer of attachments. Again, the instructions on how to check and correct this are located on the HealthLink resources page as well. The next one is attaching relevant referral documents and investigations. So just a reminder to please remember to include all relevant investigations with referrals where necessary. The eReferral form recommends the type of investigations to send, as Sid had previously demonstrated. Sending through the right investigations initially helps speed up the processes and ensure patients do get timely access to our services. And the last one would be the incomplete or blank provider numbers. Please ensure your full provider number is supplied when submitting the electronic referrals, as the initial 0 is often missing. What happens on the clinic side when we do receive that electronic referral with an incomplete provider number, we're unable to change those numbers, and we're unable to actually process or progress those referrals without the 8 digits being completed on the GP end. So the referrals just sit on that receive state. By addressing these areas, we can greatly improve the accuracy and efficiency of our referral process and eliminate a lot of back and forth, I guess, in getting additional information, which we can initially set up. Thank you, Sid. Next slide, please. So as Sid had mentioned previously, there has been a new link under the antenatal, specifically for early pregnancy antenatal services, the EPAS service. So on the back end, what happens is these referrals will go directly to the EPAS inbox, ensuring they're addressed within 24 to 48 hours. If unintentionally we've clicked onto the antenatal link, and which for an EPAS referral, unfortunately, does go to a central intake point, which can delay our clinicians in looking at those EPAS referrals. So please make sure to use the EPAS channel for EPAS referrals, and use the antenatal form for all the other antenatal matters, which goes into the central intake inbox. Thank you, Sid. Our PHN colleagues has done an outstanding job disseminating and communicating e-referral forms and updates to our GP community. They will continue to support you, offering assistance and collecting feedback to pass on to us. For technical support, please contact either the PHN or the HealthLink support team. Although the HealthLink support team are the experts on the platform and forms you use, unfortunately, our clinic users in the LHD don't have access to these forms and can't really assist with your queries. So please reach out to HealthLink for your form issues, errors, and further questions. Thanks, Sid. Next slide, please.
Just to add to that, I might just make a comment if that's okay, Risha.
Yeah, of course.
The other thing to note with the technical support, when you ring the technical support number, they'll be able to share screen and troubleshoot the issue then and there for you. So if time permitting, I know referrers and GPs are very time poor, but if time permits, it's better to do it that way so you can get it resolved on the fly. Because then any other way, either via the LHD, it might take a long period and affect patient care in that meantime for that particular referral. So it's better to call the support line, and they can troubleshoot it when you're ready. Thank you, Russell.
No worries. Thanks, Sid. Next slide, please. So just on this slide is a QR code. We'd love to understand how you're finding the new processes and user forms when submitting referrals to our clinics. As we've previously mentioned, there is a plan to roll out electronic referrals to all the other services within our district. Please complete the 90-second survey to share your feedback and help us improve our services. Thank you.
I just want to touch on one other point, just with the attachments here. So this is mostly affecting medical director and best practice. There is a setting within each of these practice management software that removes the header information for any text-based reports that come into your software. So this PDF here, you'll get this link as part of the slide pack that will be shared after. So it'll tell you where exactly to go and change that setting. So it might be specific to your, not at the practice level, but at the specific GP level, specific to your instance of the practice management software. So if you could take a look at that, as Rochelle mentioned, it's got clinical significance there. If the patient information is missing, we're not clear on who it belongs to. So just wanted to provide that additional context as well. Any questions?
No questions have come through, but JC has put in a link for the New South Wales Health eReferral resources, so I've added that to the chat for everyone. I just wanted to say a huge thank you to Referral, Sid and Ellie for your presentation today. A huge amount of work has gone into this, and it really does show. You should be proud of yourselves. And I wanted to thank everyone for spending their lunchtime with us and getting the most current up-to-date information that we have on hand. We really appreciate it. So please look after yourselves and take care. Thank you so much.
Thank you all.
Thanks, everyone. Thanks, Phoebe.